South Dakota has always been my home, and it really represents a slower pace of life and a place that you could really be self-determinant.
However, in the last couple of years, it has really just changed and has become very, very polarized. And it almost seems like South Dakota is now a state where extremism has come into play. That's not the South Dakota that I was raised in, and it's not the South Dakota that I grew up with. I grew up in a South Dakota that you could disagree with your neighbor, but you could still have them over for dinner.
When I was a child growing up in the Midwest, there was a real sense there was sort of a live and let live attitude, and that's what's changed. That it's no longer live and let live, it's live but only according to our rules.
Well, last week, national publication Mother Jones released an investigation into a secret group of lawmakers and anti-transgender organizations that were working on bills across the country. That group involved several South Dakota lawmakers.
A doctor who provides such care and recently left South Dakota is expressing concern that this could drive more experts out of the state.
A statement from Dr. Jeremy Cowles, the chief physician with Sanford Health, says in part that, quote, as written, HB 1080 doesn't follow evidence-based standards of care.
One of the most controversial bills in the 2023 legislature has Governor Kristi Noem's signature, and that has many people wondering what is next.
I'm Samantha Chapman. I'm the advocacy manager for the ACLU of South Dakota. And I worked on HB 1080 last year as the ACLU's registered lobbyist during the legislative session. As soon as the bill dropped, we worked to begin building our opposition to the bill. We view this bill as a violation of the civil rights and liberties of transgender youth as well as their parents. I think what's also really notable about HB 1080 is that before the bill was filed, a huge leak of Representative Fred Deutsch's emails came out and was released to the public, and the journalists that kind of went through all of those emails identified that he had been working with a team of people from all across the United States to develop this legislation, and they were very strategic in their approach to finding what they thought would be the most compelling argument. So again, this is not one individual lawmaker even who has experienced an issue within our state that is being addressed. This is a team of people trying to reshape this country without transgender people in it.
I was surprised to find that Fred had really led this nationwide effort, and these terrible ideas have been exported from South Dakota and replicated in lots of other places. I'm Reynold Neseba. I teach economics at Augustana University, and I'm in my 8th year as a state senator here in District 15. I'm coming back with legislation this session to take a look at 1080 that passed last year and to bring back some exceptions based on that notion of parental rights. When it was on the floor of the Senate, I tried to amend that bill to at least ensure that South Dakota Medicaid would cover counseling, and I couldn't get that amendment on. This notion that they were said that this is about helping and not harm, I think is completely negated by that notion that they wouldn't allow counseling even to be covered by Medicaid. I've talked to college Republicans at Augustana who've decided to move to Minnesota because they have friends in the LGBTQ community. They have friends of color, and they just find South Dakota to be not representative or not sharing their values. And so part of the workforce crisis that we have in South Dakota is so many young educated people are leaving the state.
My name is Representative Cameron Nelson, and I serve in the State House of Representatives. This wall that we have created for other trained professionals who are choosing not to move to South Dakota because of extremely conservative policies that ultimately affect them and their family in the future. The underlying economic impact that these policies have on our state is long-term and is very detrimental. We see a continued erosion of patient-provider relationship where the legislature, predominantly Republican, is saying to the entire medical field that we know better than you. who have gone to school for 8, 12 years in some instances in a matter of 20 minutes of a committee hearing. I attended 2 funerals shortly after this bill was passed of young people, young trans people who chose not to be here anymore.
My name is Tina Harp, and I have a master's degree in counseling. I am a licensed professional counselor, which is the highest licensure you can get in the state of South Dakota. I started working in the mental health field in the late 90s and received my full licensure by 2008. I first started working with trans people in the early 2000s, and at that time, it was much more about the fear of rejection and working through that. And then over time, it changed more into being political, in the forefront of everything. And so I think I was able to be much more client-centered in terms of what we were working on, and now I'm much more centered on coping skills and building resilience and empowering people. So it's changed significantly. Within a week of this bill passing, I had someone become suicidal, and they did have to go into the psychiatric hospital. Just so we understand how that really affects everybody, the high psychiatric hospital is about $1,000 a day. Mental health providers are always going to need a consent as long as they're under the age of 18. I find it outrageous that legislators are going up against the American Medical Association, the American Psychiatric Association, the American Counseling Association, the American Academy of Pediatrics, and of course, overseeing my licensure is the American Counseling Associations. And those are just the local ones, but then we also have the world organizations as well.
The biggest thing how it's affected our family is the care that we were previously receiving in Sioux Falls for my son. We now have to travel out of state to receive that care. My name is Elizabeth Brockmeyer, and I am the parent of a transgender teen here in South Dakota. It's about a 7-hour drive round trip. His dad and I have to take off a full day of work. If the appointment is early in the morning, we have to do an overnight. It's the loss of patient-caregiver relationship. You have to start fresh with a whole new care team. It's the government coming in and saying how we can and cannot live our lives, and to me that's the exact opposite of conservative values. So it's really upended our lives. I shouldn't have to come out and talk about my child's health. This should really be a conversation that only happens with his care team, his dad and I, and obviously himself. There have been times that I've absolutely thought it's not worth it to live here anymore.
My name is Jess, and I am the parent to a wonderful trans kiddo named Remy. HB 1080 forced my family and I to move out of South Dakota. I was born and raised in South Dakota. My kids were all from South Dakota. So I had to tear them away from their friends, their school. My kiddo came out as trans at age 11, and I wasn't supportive right away because I thought it was just a phase. It wasn't until he ended up having to stay at Avera Behavioral Health because he had a plan to take his life that it kind of woke me up, and I started researching. I feel like I was standing in the middle of the room screaming and nobody was looking at me because they just didn't allow me to choose what's best for my child. I grew up in South Dakota, so it was very disheartening to have to leave a state because I couldn't get health care for my child. I remember back when the pandemic started, our governor said that she believed that, South Dakotans can make the decisions for themselves on mask wear and staying at home and being isolated.
I find it interesting that we're in a state that is so big on personal freedom. During COVID, it was you don't have to wear a mask, that's your decision. You don't need to be vaccinated, that's your decision. But yet, certain populations, including this population, don't have the same rights. My name is Carrie Soto, and I'm a parent of a transgender child. We have to think about making an appointment up in Minneapolis, 3-4 times a year, and planning the time off work, planning the overnight stay, and the cost that's associated with that as well. When you're an elected official, you should be putting your own feelings and your own philosophies and beliefs aside, and you should be doing what's right for the constituents that elected you, and that doesn't happen often.
Having the government interfere with a parent's decision to access certain medical care for their kids is not a traditionally conservative type of piece of legislation. We saw Representative Jess Olson stand on the House floor and make that same case when she, as a Republican, voted no on HB 1080, stating specifically that it's not conservative.
My name's Shaniqua Brokenleg. I am the staff officer for racial reconciliation for the Episcopal Church. I'm also an Episcopal priest here in the Diocese of South Dakota. And I'm Sichel Lakota, which means I'm from Rosebud Reservation, and I'm Winkte. Here are these people that, in my culture, are sacred. Even our word for child literally means sacred one, right? And they're so valuable, and yet society is telling them, and our government is telling them that they're not. And they don't feel safe. And you, of course, as an adult and as a leader in your community, are expected to care for them and protect them. And yet here's this law that says that you can't treat them in the way that they need to be treated. In Lakota culture, a community is considered whole or healthy if it has certain people in them. And one of them are men and women or people who heal with medicine. One of them are men and women or people who heal with ceremony. And they should have social political leaders, and they should have strategic or military leaders. The other group that makes a community whole are the Winkte, are the Two-Spirit people. I wonder what our society would look like if we held up our Two-Spirit people and our LGBT people and saw them as an integral and important part of a whole or healthy community, because we haven't done that in this society. And I wonder the beautiful and amazing things that could come out of that. And I think sometimes people have this problem of fearing what they don't know. That's one of the things that I get sad about in Western culture. Like in Lakota culture, we see difference as something that's sacred. And I think in Western culture, difference is often seen as something that's other or bad. We should always seek first to understand, right? Before we judge or try and wipe something out. And clearly they don't understand our community. When you look at the story in the gospel and in the Bible, the first person who was baptized that was not Jewish was a sexual minority. It was the Ethiopian eunuch, both a person of color and a sexual minority. And if we are supposed to follow in those things, that means that should be the people that we're reaching out to.
Laws like HB 1080, they might be tailored directly to discriminate against transgender youth and their families, but essentially this is a bodily autonomy issue, this is a self-determination issue, and that affects everybody.
What we need is more people like you involved in the South Dakota legislature. Find a place to start. Make this the year that you send an email, make a phone call.
Transgender people are minorities and they need allies. You know, the way to be an ally is to trust the fields, to trust the mental health fields, to trust the medical field.
Contact folks who are doing the work already.
1, educate yourself. 2, to find community.
When we walked in the Pride Parade last year, I was amazed at the tremendous support and show up and how many people are out there cheering. And all I could think of though is if you really support this population, like, get out and vote.
Now more than ever, it's really important that if you are an ally, you are vocal about being an ally.
No matter what side of the political spectrum you fall on, I feel that we all want similar things, and that is to be able to be who we are.
Hi, my name is Willow, and I'm from South Dakota. I'm pretty much a normal kid. I don't like doing chores. I love hanging out with my friends. I think of it like maybe as like if you get hurt while like playing and you feel that pain, then that's what we feel when people bully. If you want to help kids like me, you should come and get to know us.